please mute your phones. We will stop the news conference if any phones are not muted. Okay, I think it sounds okay.
We're good to go.
Okay.
Going live.
Okay, again, thank you for joining us, everybody. Our first speaker is Governor David Ige.
I want to start by thanking the people of Hawaii during these unprecedented times. Today is day one of the statewide stay-at-home order, and I'm fully aware of how this mandate is a challenge and burden for everyone across Hawaii. I cannot stress enough the importance of staying at home or in your place of residence. This is the only way we are going to slow down the spread of COVID-19 in Hawaii. I know our community understands why this order is necessary. However, it impacts our neighbors who have lost their jobs and businesses that have closed their doors. Today, I'm announcing state programs available to provide relief to residents directly impacted by this crisis. The Hawaiian Homes Commission has approved the deferral of mortgage payments for the Department of Hawaiian Homeland's direct loans for a period of 6 months. Hawaiian Homes Commission Chair William Ige will provide more details on the program. The Hawaii Department of Human Services provides important safety net services for the most vulnerable in our community. They are announcing today several measures to ensure that essential services will continue to be available and continue uninterrupted. This includes Supplemental Nutritional Assistance Program, or SNAP, child care facilities and homes, and MedQuest. DHS Director Pankaj Bano will provide more details. The COVID-19 crisis has also created a lot of uncertainty for Hawaii's graduating seniors. University of Hawaii President David Lassner is also here to announce that they will extend the application deadline for UH Manoa, UH Hilo, and UH West Oahu for the next academic year. This will help to ensure that the graduates will be able to attend college in the fall. And from the Department of Health, Dr. Bruce Anderson will provide an update on the latest number of COVID-19 cases in Hawaii. But before I turn it over, I would like to address an issue that many have been calling my office to inquire about. Let me make it clear that my overriding priority is to protect the health and safety of Hawaii's people. This is what we all need to focus on. Anything else at this time is an unnecessary distraction. Lieutenant Governor Josh Green is still the healthcare liaison for the state of Hawaii. Nothing has changed since his being appointed to that role. The Lieutenant Governor is charged with evaluating the medical community's readiness to deliver care to individuals who test positive for COVID-19, evaluating Hawaii's current equipment supply, including personal protective equipment and ventilators that are so crucial in providing care, and coordinating efforts to secure additional as needed, and advocating for funding at state and federal levels. I welcome the advice and suggestions from the Lieutenant Governor Green, as well as anyone else who has recommendations on how we protect our community. However, as governor, I developed my health policies related to COVID-19 with the advice and guidance of national experts from the CDC, the Hawaii Department of Health, and Doctors Bruce Anderson and Dr. Sarah Park. Both Doctors Anderson and Park are trained epidemiologists whose careers have been devoted to the study of preventing epidemics. I have been working closely with our county mayors and my department directors on policies to protect our communities, and I ask all other elected leaders to put aside their personal agendas and do the same. Mahalo.
Our next speaker is William Ige, Director of the Department of Hawaiian Homelands. And before we move on, again, if you've just joined us, please mute your phones. We just heard someone cough, so we know that someone's not muted. Please mute your phones. Thank you. Mr. Ige.
Aloha. Yesterday, with the strong support of the governor and the approval of the Hawaiian Homes Commission, the department is hereby authorized to postpone mortgages from our direct loan programs starting in April and going on for 6 months. There are more than 1,200 of these mortgages. For mortgages with private institutions, and there are more than 3,900 of these, I urge you to make contact with your lender. The department has also sent a letter to HUD Secretary Bruce Carlson requesting that both the 184A and 247 HUD programs adopt similar stances to what the commission approved. If you have any questions, make sure you call your lender on this issue. This is a postponement of payments for the next 6 months. Thank you.
Thank you, Mr. Ige. Our next speaker is Pankaj Vinod, Director of the Department of Human Services.
Aloha, everyone. Thank you, Governor, for the opportunity to provide some information related to very critical programs for our residents across the state of Hawaii. The Department of Human Services is taking aggressive actions to protect the health and safety of the individuals and families we serve by maintaining essential services to help the people of Hawaii during the COVID-19 crisis. We are working collaboratively with the community, with the department leadership, with the executive departments of state of Hawaii, particularly the Attorney General's office, and our federal partners to ensure that we are providing uninterrupted services to our residents who are currently receiving the services and all future applicants for all our services. However, we are doing that in a modified manner, and that means limiting face-to-face contact with the public to protect the health and safety of everyone, especially vulnerable individuals, as well as DHS employees and providers. We have already begun to receive and process new applications for benefits and services in response to COVID-19. Our essential services will continue uninterrupted, and our employees shall continue to report to work from the office, the current locations where they provide services from, or remotely from home. During these challenging times, we'll continue to serve our state with aloha. Together, we honor our commitment to supporting our collective community, individuals, and families from Keiki to Kapuna. I have a lot of information that I want to provide regarding critical benefits and services, starting with SNAP, the Supplemental Nutrition Assistance Program, which is also formerly known as food stamps. First, there is a reduction in staff at administrative offices and our processing centers where we normally provide services out of, but they are working hard to manage the workload and provide reduced exposure for all. Please be patient with our staff as they work as quickly as they can to process requests and applications. Telephone will be the primary means to contact BESD, Benefit Employment and Support Services Division, processing centers, and other offices. Please refer to the DHS website at humanservices.hawaii.gov for the phone number of the processing center nearest to you. If you visit a processing center, signage will instruct you to drop off your forms in the drop box and to contact the office by phone. The phone number will be posted on a sign there for your convenience. While the lobbies are officially closed during the pandemic, if you do not have access to a phone, signage will instruct you how to alert BESD staff at the center that you have no phone. Staff will work with you in all possible ways to serve you. Hawaii Electronic Benefit Transfer, the EBT card on which the benefits are loaded, will be mailed to the address you provided in the application instead of being picked up in person. Please ensure that the address provided is correct. Now I would like to talk about the first-time applicants. If you're applying for the first time, we invite you to use the electronic fillable application that is available on the DHS website. It's humanservices.hawaii.gov. Once complete, you may print, sign, mail, or drop off the application at a processing center nearest to your home as noted above. Or if you're unable to place your signature on the page, you may scan or take a photo of the signature page and send it as an email attachment to BESD, BESSD, statewide branch, one word, at dhs.hawaii.gov. The current recipients of SNAP, there is a change in that as well. SNAP certification period for recipients requiring 6 months review or eligibility reviews during the months of March, April, and May will be extended an additional 6 months to ensure no lapse in benefits due to the pandemic. A notice will be sent to you at the last known address on file via U.S. postal mail providing more details. Please do review the notice. Notice will have very important information that you may be required to provide to the department to provide you with benefits on an ongoing basis. Due to this pandemic, U.S. Department of Agriculture, the Food and Nutrition Service, has also waived the able-bodied adult without dependents work, education, and training requirements. This is in response to the decline in available work and closure of training courses due to the pandemic. We have also requested a waiver for part-time students, those who are less than full-time, who are unable to meet 20-hour per week work requirement to maintain their SNAP benefits. Hopefully we'll get that waiver and we'll provide additional information to the applicants and to the residents at a future date. And this is warranted because of the closure of all the food establishments, entertainment, and recreation businesses because of the pandemic. Furthermore, we are doing many more things to ensure the seamless and uninterrupted availability of our benefits services across the state. So please be patient as the federal requirements change and we come up with creative ways of ensuring the uninterrupted way of providing benefits and services to the residents of Hawaii. Please be patient and wait for that information to come, because we are not open for face-to-face contact. Most of the queries have to come through online, email, or through phone. Regarding I want to talk about Medicaid. It's a lot of questions are coming in for Medicaid. First of all, I would like to say is that like all other healthcare services we provide through Medicaid, there are no co-pays for services related to COVID-19 for MedQuest. We also encourage all our Quest recipients and future applicants for healthcare insurance to apply online if you are in need of healthcare insurance. If you do not have access to a computer to apply online, staff are available to help you complete an application over the phone. Please note that due to the current situation, phone wait times are longer than usual. More details with application links and contact phone numbers are available on MedQuest's website, and that is https://medquest.hawaii.gov. One more important point regarding our MedQuest division. MedQuest will postpone implementing new contracts regarding health plans until further notice, as we are fully devoted to responding to this public health crisis and making sure MedQuest beneficiaries receive the care they need. Please continue to contact your current provider under your existing health plan. One more point. This does not mean that the current procurement that is underway has stopped. That will continue. But until further notice, current contracts remain in force. Now, a little bit talking about supporting individuals with disabilities. Most of the programs, services, and benefits currently provided by the Division of Vocational Rehabilitation, they will continue uninterrupted through telephone or through online services, supporting houseless individuals and families. All DHS-funded homeless shelters and outreach programs are also considered essential services. DHS Homeless Programs Office is maintaining close contact with providers and are working with them to provide flexibility with contract requirements and have established weekly office hours for our providers in partnership with the Department of Health and Behavioral Health Services Administration. Homeless services outreach staff continue to make sure basic services are provided and offered to unsheltered individuals. DHS has also been in contact with domestic violence shelters and is working to ensure these essential services continue. Now, a little bit about child welfare and adult protective services before I make a couple of comments regarding the availability of child care subsidies and child care providers-related issues that we are getting a lot of questions about. The health and safety of our families and our staff is a priority. Child welfare services.
Okay, we're getting feedback, guys, because someone is not muted. Please mute your phones. We will stand by and wait until you do so. Are we muted?
The health and safety of our families and employees are our first priority. Child Welfare Services and Adult Protective and Community Services Branch will continue to respond to reports of any instance of abuse, neglect, harm, or exploitation. We have advised our staff to adhere to social distancing when visiting homes, at least stay 6 feet from the other person. We have advised our staff to adhere to all other Department of Health and CDC requirements regarding the COVID-19.
Please mute your phones. We can still hear you, and we're getting feedback. We are unable to continue with this news conference until we're muted.
For information regarding child welfare services hearings in family courts throughout the state, please visit the judiciary website at https://www.courts.state.hi.us. Due to strict social distancing, family visits between parents and children are being modified, and arrangements are being made through video conferencing methods and other technological means. Now with childcare, we are going to continue our childcare operations both on the subsidy side and the childcare licensing side. Each individual childcare facility or home is assessing whether it will continue to operate and offer services. Some facilities and homes are continuing to provide childcare to essential workers during this time of need. The State Emergency Operations Center, EOC, in consultation with the Department of Health, are the lead entities to identify if a case or a person under investigation is associated with a child care facility or home. If it is determined that anyone at a child care facility or home may have been exposed, EOC and Hawaii Department of Health will work closely with the affected child care facility or home to minimize the spread of illness. Hawaii Department of Health and the Centers for Disease Control have guidance for schools and universities, which also applies to child care facilities and can be found at the Department of Human Services website. That is at humanservices.hawaii.gov. DHS is continuing to identify ways to provide emergency childcare for first responders and will be providing more updated information in the coming days. We are working daily alongside our Attorney General's office, federal partners, community partners, and stakeholders to ensure continued childcare for essential workers in our community. Thank you.
Thank you, Director Bonneau. I'm hearing some ambient noise, guys. Can you please check to see if you're muted? Just check, everybody. Just check one more time. Our next speaker is David Lasner, President, University of Hawaii.
Aloha, and thank you, Governor, for this opportunity to be here, a fellow proud UH graduate. Recognizing the turmoil and uncertainty facing everyone in the community today, the University of Hawaii is extending the deadline for application for admissions to our 3 universities until August 1st, 2020. Prospective students can already apply to our community colleges right up until the start of the semester. We found that many parents and students are now thinking about staying home for college, and you really can't beat the opportunities that are available across the UH system. We have something for everyone at UH. For our own graduating seniors, we know students are thinking about coming home from mainland colleges, and we also welcome adults who are impacted by this crisis and may take the opportunity for higher education to help them improve their own economic conditions as well through a career change. We have a wide range of superb higher education programs online and delivered through our campuses and centers across the islands. Data show that people who earn a college degree or certificate earn more over their lifetimes. A bachelor's degree is worth as much as $1 million or more over a lifetime. They are less likely to become unemployed during a recession. They are faster to get jobs back and return to the workforce after a recession. College graduates live longer, live healthier, are less likely to become incarcerated. They vote more often, they volunteer more often, and their children are more likely to follow in their footsteps into higher education and achieve these benefits for themselves. The University of Hawaii is recognized around the world as affordable at every level, from our amazing community colleges, our welcoming baccalaureate institutions, and our truly outstanding global world-class research universities. Check us out at apply.hawaii.edu.
Thank you, Dr. Lasner. Our next speaker is, our final speaker is Dr. Bruce Anderson, Director, Department of Health.
Aloha. The 14-day quarantine requirement for all incoming visitors is intended to keep individuals from inadvertently introducing the virus to our community. That includes, of course, visitors and returning residents. We actually have more people coming back from trips, residents bringing the virus with them, than we do visitors. So it's important that this apply uniformly. We continue to work very aggressively on identifying cases, quarantining those individuals or isolating them if they're ill, and of course contacts of those cases. We've been doing that since day one, and we continue to do that today. Today, the Department of Health is reporting 6 positive cases, test results from private physicians, which brings the total number of individuals diagnosed as positive for COVID-19 to 95. 4 of the new positive results were for residents on Oahu, and 1 was a visitor on Kauai. At this time, there have been no deaths in Hawaii attributed to COVID-19. On Monday, we reported late in the evening what we thought was our first death that was associated with this. This was an elderly individual who had underlying health conditions who actually passed away several days earlier. He had been tested by a private laboratory. The sample was sent to us and tested and found to be negative. Unfortunately, in the handling of the information as it went through our department, there was a mistake made, and the test was recorded as positive. We retested the individual again just to be sure that it was negative, and yesterday the result came back as negative. So I'm very pleased that we haven't had any deaths in Hawaii, and I regret the error, which may have caused some anxiety and among family members and others, and I certainly apologize for that mistake. Nevertheless, I do think it's important we get information out quickly. We can expect that we may make mistakes from time to time, but under these circumstances, I think it's important that everyone be notified as quickly as possible when these sorts of things occur. As I mentioned, we had 6 cases today. We are still investigating many of those, and we are expecting to get even more information on those, but they all have a travel history or have been exposed to someone who has traveled. which is typically the case. We haven't seen any evidence of widespread community transmission. To date, we've received samples of over 4,200 tests completed to date by clinical laboratories. We've also now tested 370 individuals who, through our own state laboratory. Many of those tests were done to determine whether or not there is community transmission. And I'm pleased to report that we haven't seen any positive cases among those that we've tested for that purpose. The top positives we are seeing are people who are going to see their physicians who are identifying this as a potential case and having those results, having those tests done. And of course, we then are notified when that happens. The physicians in this state are our front line, and we support them entirely as they go through this process. I wanted just to emphasize that individuals who are not experiencing symptoms do not need to go see their physician. But if you are and concerned, you should see your physician. You should always see your physician before you obtain a test. That way the physician appropriately orders the test and can advise you when the test results come back. Whether it's COVID-19, the flu, or whatever it might be, you need to work through your physicians. So that's an important point. This morning I was listening to a telecast from our Surgeon General of the United States, and he offered some good advice, I think, to all of us, and that was to treat the situation as though you were infected with COVID-19 and do what you would do if you were infected. Distance yourself from your friends. Be sure that you're not violating that social distancing aspect of the disease that's so critical in preventing its spread. We can do what we can to retard the introduction of the disease through these aggressive measures that we're taking, but ultimately it's going to be how we interact with each other and keeping that social distance as to how effective we are in reducing the spread of the disease here in Hawaii. So take the recommendation seriously. Don't think this is something you should be taking seriously. You should all take it very seriously. If you have any doubt about that, you need to watch what's happening in New York. But thank you very much, and we'll keep reporting these daily basis, these numbers that we give to you. Thank you.
Thank you, Dr. Anderson. We'll open it up to questions now. I'll call on individual reporters in the order that we receive your RSVP. Also, please let us know to whom you are addressing your question, so that at the top of your question, so that we avoid any lag time and to give the speakers a few seconds to get to the podium. Again, please mute your phones when you're not speaking, unmute it when you're asking your questions, and mute it again. Thank you so much. Our first question should come from Civil Beat, Eleni Gill. Eleni, are you there?
Can you hear me?
Yes. Go ahead, Eleni.
Hello, this is Joanne. But I can't tell if you can hear me. I'll go ahead and ask my question.
We can hear you. Okay, hold on. Eleni, someone is not muted, and therefore we are getting some feedback. Eleni should be the only one unmuted. And Eleni, this might be your line, I'm not sure, but go ahead, Eleni, we'll try to understand what you're saying.
I still hear you.
Disability? Okay, Director Benoit is heading to the...
What shelters
What shelters are being considered? Okay, can you repeat that in a nutshell, Eleni? It might be Eleni's line. Can you understand?
Eleni, are you asking that if Department of Human Services have identified certain facilities or properties to shelter people?
I'm so sorry, I can't hear anything.
Can you come closer?
I cannot understand the word.
Eleni, is your question related to if we have identified shelters or properties to house people.
I'm sorry, you need to hit,
Devices are turned down, so we're not getting the reverb back from.
yes, please mute.
No, I'm on mute. I've been on mute the whole time.
Okay, we should only be hearing Eleni.
Hi, it's Eleni. Check one more time. Wondering what the plan is for houseless population, what the status is of the Ka'ahi facility, and if it's open and operational, if the state plans to use hotels, and just hospital capacity expansion in that regard, especially for our houseless population. Thank you.
I think the majority of it would be coming from Dr. Anderson, but as far as we are concerned related to our houseless residents that we are serving, the houseless residents that we are planning to serve, we are continuously working with various property owners, including hotels, to identify the places where we can actually have our houseless residents be housed. Dr. Anderson.
Okay, before we continue, can we also ask everybody to turn down your Facebook Live? If you have us on Facebook Live, please turn down the volume. That and multi-speakers not muting their phones is causing this terrible feedback. So please help us out. We appreciate it.
The state has just stood up. We're still getting some feedback here, but the state has just stood up a facility in Evelay for quarantine and isolation of homeless, those who may need shelter that don't have it right now. The policy is now to try to keep the homeless from dispersing to other areas, and I believe that some of the public restrooms are being opened again so that they would have places to wash and as much as possible maintain their themselves. And we are wanting to assure that those who do not have housing have a place to go. So that, as of this morning, I believe, has been stood up. We're providing wraparound services for those who need that type of shelter, and we'll continue to do so. Most individuals who are identified as needing to be isolated or quarantined are being either isolated or quarantined in their home, or if they're not at home in their lodging, wherever they may be, which has proven to be very effective so far. We've gotten good compliance from those individuals who have been in those situations, and we expect that to continue. But we are aggressively looking at other facilities across the state to see where individuals who do not have alternatives could be sheltered in isolation or for quarantine purposes. The visitor industry has stepped up, and they are looking at some of the vacant hotels as a possible site for those who need housing. And across the state, we're looking at shelters that could be used for that purpose. I might add that we're also looking at different situations that may require more extreme measures. But so far as it's been, we've been able to accommodate those who need those shelters. Thank you.
Okay, Eleni, Director Bonot has something to add.
The Ahi facility, we are working on making it operational as quickly as we can with the Behavioral Health Administration of Department of Health, with Administrator, the Deputy Director Eddie Mercero, and our Homeless Programs Office, along with Governor's Coordinator on Homelessness, is working collaboratively to get that done so we can have wraparound services and other things available to the Hawaii residents who will be staying there during this COVID-19 crisis. Thank you.
Thank you, Director. Do we have Hawaii Tribune Herald on the line? Stephanie? Okay, moving on. KHON, Sarah, you're there.
Can you hear me?
Yes, we can, and we're still getting feedback. Go ahead, Sarah. Sarah, can you hear us? KHON? Okay, Hawaii News Now. Ben Gutierrez, are you still there?
Yes, I am.
Sarah, was that you? Okay, Sarah, we'll get back to you. Ben, go ahead. We can hear you clearly.
All right, this question is for Governor Ige. Governor, there are reports saying that you had ordered cabinet members not to talk to or consult with the lieutenant governor. I'd like you to comment on that.
I have not made any such order or direction.
Okay, Ben, did you have another question more on topic?
One more question. This one is for Dr. Anderson.
Dr.
There
Anderson
were
is heading to...
4,200 tests. How many have been completed? And how many people have recovered of the 95 who I believe have been diagnosed as positive for the virus?
4 of the 95 were hospitalized. I believe 1 remains in the hospital. Most of the others are either recovering or not requiring hospitalization. I should elaborate a little more on the numbers that we have. We've now tested 4,658 individuals. When I say we, I'm using that word collectively. That is both the private labs, the state labs, and of those, we have 95 positives and over 4,500 negative results. Again, that's the best information I can provide. I hope that answers your question.
Thank you.
Okay, thanks, Ben. Sarah Madison, are you there, KHON? Have we lost Sarah?
Yes.
Okay, go ahead, Sarah.
Yes. Okay. This is for Dr. Anderson. Can you tell us how there was a mix-up with the positive, the false positive test reporting? The one with the first test, and there was also another report of a false positive.
No, let me repeat what I said earlier. We wouldn't call it a false positive, actually. A false positive is a test where you tested and you found a result that's positive and it actually turned out to be negative. We have, this week, had one situation that I know of, one we reported, of course, where we did have a negative test result that was miscoded and transcribed as a positive test when in fact was negative, and that was unfortunate. It was essentially a clerical error. Again, the sequence was this individual was tested. He actually passed away a couple of days before the test results were available from a private laboratory. That private laboratory could not determine whether the case was positive or negative. They submitted the sample to us. We're a reference laboratory essentially, and serve as that for not only Hawaii but the Pacific area. We did do a test on that sample. It was found to be negative. Unfortunately, again, the result was coded as a positive when it was transmitted. We reported it immediately as a positive, not having a chance to go back and reconcile the information. The following morning, it was identified that there may have been error in reporting, and we went back and found indeed it was a negative result. Just to be sure, we went back and retested the sample, and we confirmed it was negative. So we actually got 2 negative results on this individual. No question that it was. And of course, immediately sent a press release out explaining the best we could what had happened in that situation. Again, it was unfortunate, and my apologies to those family members and others who may have experienced some anxiety unnecessarily, thinking their loved one had COVID-19. That was not the case. This individual passed away from other underlying causes. Obviously, we have a lot of ill people in the state, and many of them are in very fragile condition, and even the flu or of course, COVID-19 could be the tipping point for these individuals. We were concerned this was the case there in this case, but that was not to be. And again, that was a simple reporting error that hopefully will not occur again. We have made changes in our reporting procedures to be sure that we're double checking the results of any positive results so that we don't inadvertently make the same mistake. Thank you.
Sarah, did you have a second question?
Yes, that was for the first test, but I'm also hearing there's another report of a test that came back positive, and as the person was informed again that it was actually negative. Do you know anything about that mix-up and how that could be avoided?
I'm not aware of any other reporting error. We have had some situations where the tallies were not accurate. That we reported twice cases, and we had to make some adjustments, given that some individuals were double counted. But this is the first time that I'm aware of that we've ever had an actual report, an reporting error where a negative was reported as positive, or vice versa. Thank you.
Thank you, Dr. Anderson. KITV4, Rick, are you there? Rick Kwan.
Yeah, Jody, can you hear me?
Yes, we can hear you, but we're getting some feedback. So if anyone's online and you can hear your Facebook Live, please turn it off. Go ahead, Rick.
Jody?
Yes.
Okay, my question is for Governor Ige. I wanted to know from him, looking at the number of positive cases, I think the last few days it was 8, 21, 14, and 6. How successful does he feel the state is doing in flattening the curve?
Well, I think you have to look over the long haul. I think it's too early to tell. We have to look at the number of cases over the long term. I think we all have to remember that we are testing more individuals. As Dr. Anderson had reported, we've actually completed now 4,600, more than 4,600 tests. If you recall, the first week or so, we were doing, test 1 or 2 or 3 at a time. So the fact that we are testing more individuals will result in more test positives, obviously.
Rick, did you have a second question?
I did have a question for Dr. Anderson. Earlier, when he was testifying before the senators, he was asked about people not taking this coronavirus seriously, and he said we might have to instill fear in people. What exactly did he mean by that?
It's probably the wrong way to put it. I think what we need to be sure of is that people see this as a serious situation. I think we've been very successful to date in keeping most of the virus out of Hawaii. Again, we're seeing situations where people are bringing the virus in, introducing the virus after travel or coming into contact with travelers. And actually that's be expected given the widespread transmission that's occurring elsewhere in the world. We would think that we'd actually even see more of it than we have, but we haven't seen it spread widely in our community yet. The experience has been in many areas that it will get to our shores. We will be able to do what we can to keep it offshore, but having said that, it's almost impossible to completely isolate ourselves from this situation. As much as we try, that is unlikely to be the case in the long run. If it does get introduced, then it very well may. Our job will then be to try to keep the virus from spreading in our community, and that involves social distancing, staying apart from other people. The disease is transmitted from person to person, and the only way that we're going to effectively be able to keep it from spreading is to maintain our distances so we don't do that inadvertently. I'm almost certain that we're going to end up with a much more serious problem than we have today. It's been the case everywhere in the world where it's been introduced that eventually it gets to be spread in the community widely, and at that point you really need to take this seriously. I think a lot of people here are taking it seriously. I've personally witnessed there are more people on the streets jogging and so forth than I've seen trying to get exercise, but people are staying home. But they need to be sure that that they don't think that because we're only getting a handful of cases now that that's going to be the case. We need to stop the spread before it becomes community-wide. We need to take very aggressive actions to keep it from spreading. Once it starts spreading, it's too late. the measures are going to be much less effective. Now is the time to practice that social distancing so it does not spread. I don't think it takes fear. I think it takes a community like ours where we care about each other and really take these situations seriously and do our best to not be contributing to the problem. And hopefully we won't have as serious a problem as we've seen in other parts of the world.
Thanks, Dr. Anderson. Big Island now. Max Stiebel, are you there? Max? Okay, moving on. Associated Press. Audrey, you're there, right? Audrey McAvoy? Star Advertiser, Dan Nicasso, are you there?
I am here, Cody. Thank you.
Thank you, Dan. Go ahead with your question. Who are you directing it to?
Well, can I direct one question to Governor Ige and one question to General Harper, please?
Absolutely.
Governor, are you there?
Yes, I am.
How, to follow up on the previous question, are you happy with the visitor and resident response to social distancing? Number one, and when do you think when are you worried that we might start seeing an uptick in confirmed cases, whether it's more testing or more infections, or what? I mean, are we looking at next week, a couple weeks? What is your concern about when we might start seeing a spike, and how are you in response to how people are social distancing in general?
I really do want to thank the entire community for really taking the message of social distancing to heart. We do see, if anyone has driven through Waikiki recently, there is significantly less tourists. And as all of you know, the 14-day mandatory quarantine for visitors and residents goes into effect this evening at midnight. And I believe you'll see a further reduction in the number of visitors to our island. So Dan, I do believe that the number of COVID positive cases will remain in the range that they are. They will increase. That is inevitable. But if we can stay focused until April 30th, I think as everyone has committed to these extreme measures, I think you will see a tapering or at least a flatness to the number of cases over that period of time.
Okay, thank you, Governor. John Hall.
Gerald, can I ask you a question, please?
Sure.
He's right there.
Dan McCosker here from Star Advertiser. So, you have been talking about from the early days about potential alternate distribution sites for key materials. Two questions about that. Where are you? Have anything been identified? Is there a timetable? And number two, what about the social distancing even at alternate sites, and especially among Kupuna, who are in a high-risk category?
So the distribution site, you mean like for the large package stores and other stores for the high demand items for the COVID?
Well, yeah, there's been some discussion about that. I mean, away from the traditional retailers, have there been any sites identified, and how is that being set up? And if so, and the other is, what about social distancing among alternate sites and even the regular retail?
Okay, so we're still in the planning stage. Actually, we kind of got busy with some other, crises, but we are in communication trying to get locations like the Aloha Stadium, also some of the universities or colleges that have large parking lots, and trying to set that up. So that's still a work in progress. As part of that, though, we were trying to see if we can get like the first 2 hours to be just for the kupuna and the high risk, people that are vulnerable, to the disease. But again, that's still in a work in progress. I'm not sure about the social distancing question that you have, though.
Right. Yeah. So in my look, whenever I go into a store, it's not that often. You know, we're all lined up behind each other and that kind of thing. Is there any discussion? Maybe it's a brief answering question. Is there any discussion about recommendations to the public when we do have to go out and be among each other?
We've been pushing that out. You know, it's daily in the Department of Health advisory and every, all of our flyers. The basic rule is try to stay at least 6 feet away from someone. Pretend there's a bubble around yourself. Governor Ige talked about the stay-at-home order. If everyone followed that, we wouldn't have to issue more stringent requirements, right? So that's why we keep telling everyone to please follow the social distancing rules, even at home. You should try, I haven't been home for about 2 weeks, but those that stay with me near my office and in their offices at work, we stay 6 feet apart. All of our meetings were 6 feet apart. Our rooms, we try to keep no more than 10 people. We're following the CDC guidelines and what the state has been putting out.
Thank you, General. Thank you, Dan. Is everybody satisfied? Do you need, I hesitate to do another round because we're on an hour right now, but do we have other questions?
Hi, sorry, this is Ashley from Hawaii Public Radio. I didn't get called, but I do have some questions if I can ask them.
Okay, to whom?
This is more, I think this could go to either Governor Ige or General Hara. I was wondering if there are any concrete plans to build out any hospital facilities, or if that's mainly going to be on the individual hospitals themselves to do that.
We're working closely. So the Hawaii Tourism Authority are working with hotels and similar type buildings, also in coordination with the Army Corps of Engineers, the U.S. Army Corps of Engineers, Department of Health, and the Hawaii Emergency Management Team, doing assessments of these facilities. The Corps of Engineers has a plan that they can actually within 2 weeks retrofit the rooms and do some refurbishment and working on the air conditioner system to turn it into a negative pressure room. So that's a work in progress. The teams are out there doing the assessments now. The limiting factor would be if the supplies and the construction material are in the state or in the county. So that's the first thing. And obviously, the hotel would have to agree to us refurbishing their rooms. But we are looking for that option. Also, the other challenge is, that's just turning the room into like a hospital room. It won't, we still need to find the beds and all the other medical equipment and the staffing, right? The doctors, nurses, physician assistant. But we are definitely working vigorously on that.
Is there a number of hospital beds that we would need or that you guys are looking at to increase it to? And then also, are you going to be calling on maybe retired doctors or nurses to kind of come out and help? Or because I've seen that in other states, governors doing the same thing.
So right now we're looking at one facility per county. I think we're going to try to increase that later. And then I believe it's 100 rooms per facility. Sorry, could you repeat the second part of your question?
Ashley?
I couldn't hear that.
Can you repeat the second part of your question? Yes, please.
Okay. The question was, do you have an estimate of how many beds you would want to increase Hawaii's capacity to? And then also if you would be calling on retired doctors or nurses to come out and help with administering health care.
Okay, yep. So right now we got one request in for refurbishing 100 rooms per county. Additionally, we have 150 beds for this. Remember what it's called? The mobile hospital. And as far as the retirees, yes, we are looking at recalling those that have retired, medical people.
Excuse me, did I get a question in?
Go ahead. Who is this?
Hi, this
Tom Presinardo from Kilo Christian Broadcasting, or Hawaii Christian Broadcasting.
Who would you like to direct your question
This
to?
is for Governor Ige.
Governor?
Let me know when you're ready. So if a particular island over a period of, let's say, a week or so does not see any new infections, at which point will you determine that that island can go back to normal operations or business as usual?
I think you have to remember that what we are trying to do is, what happens or how does the infection spike? It really is someone who's infected that comes into a community and infect others. So I do believe that the actions that we've taken statewide for 14-day mandatory quarantine for incoming travelers, right? It's residents and visitors alike, as well as the stay-at-home orders, will have to be in place statewide until we can reduce the number of COVID-19 infections statewide. Obviously there are other things that we could look at, but if people are traveling inter-island, then they could introduce the virus into those communities.
Okay, thank you, Governor. We have time. We have time for one more question. Sorry, we're going to give that to Esme.
I didn't get a question yet.
Okay, we have two more then. One to Esme. Esme Akumu, go ahead. Esme, are you there?
Hello?
Oh, yes. Hi. Hello. Can you hear me?
Yes, go ahead, please.
Hello.
Go ahead.
Yes. Hi. This is Esme Infante. I'm with 94.7 Kumu Radio and Pacific Media Group. I have a question for the governor. This is kind of like a consumer question that our listeners have actually asked us. So I heard earlier that Hawaiian Homes, mortgage holders will get that deferral, which is wonderful. But there are a lot of laid-off people here in Hawaii who are stressed out about not being able to pay their mortgages or rent and living paycheck to paycheck. So my question is, will there be any kind of wider directive or guidance from state or federal level encouraging deferral, or is it just up to the individual consumer to just basically plead their case to their landlord or mortgage company and just hope for the best?
No, there definitely has been a push at both the local level as well as the national level to stop to encourage landlords to not pursue evictions, to encourage mortgage holders to not pursue forfeiture, because I think everyone recognizes that this is an unusual and extreme time for the entire country. So certainly I think that the lenders as well as landlords are trying to be compassionate with those that they serve. At the same time, because I know that I've had questions from landlords. Some landlords owe rent for being a landlord. And so if the tenant does not make payment to them, then they won't be able to make payment to the person who owns the property. So, we are encouraging everyone to really allow maximum flexibility. We also are working with the private sector through philanthropy to identify those gaps in what lenders can do and what the government can do, and looking at the private sector to fill the gaps that government or businesses cannot fill. And so we definitely are looking at all the aspects and the challenges that our community faces, and looking to see how we can, as a community, come together, public, private, and government, and really trying to help everyone through these next few months.
Thank you, Governor. And that one last question we have from the person we didn't hear from yet. Go ahead.
Yes, my name is Jürgen Steinmetz. I'm with eTurbo News. I'm wondering, we have been monitoring the situation worldwide as a global publication, and Hawaii, of course, as an island state, has a certain disadvantage, but also has a certain advantage. I can tell you the Seychelles, what is similar of the size of Oahu, now will be requiring that anyone who's boarding a flight to the Seychelles is tested, and then there's a 2-week quarantine. Since you, Governor, said that essential travel is the only way anyone should consider going to Hawaii, wouldn't that be something to think about? The Seychelles is following the example of Nepal. Nepal has the same rule, and of course, where people cannot board a flight to Kathmandu unless they have been tested, and then there is also a 2-week quarantine after this. And if you look at the cases in the Seychelles and also in Nepal, with 3 cases, it's very minimal. So it looks like maybe that is a good opportunity, a good way to absolutely make sure.
You know, certainly we're working, the state can control a certain portion of transportation, both airlines as well as cruise ships. And so we are working with the federal government to see which requirements to, whether it be testing or quarantine, can be applied to everyone all across the country. At the same time, we are looking at what authority we have here in the islands. You know, the decision to require a mandatory self-quarantine on everyone coming into the state was what we could apply, and we had the authority to do. And we felt that it was very important to protect our community to do that. We certainly would look forward to working with the federal government and the private companies, the airlines, to look at what we can do as a transportation system to make sure that those who are infected by COVID-19 are not traveling into other communities and then infecting the residents there.
Okay. All right. Thank you, Governor, and thank you all of our speakers. Thank you, media. If you have additional questions that were not addressed, you can please email the COVID media email address, and we will probably see you a little later. Also,